Thanks for watching the Dr. Gilmore page. Check out the link below for Meta 7.
I'm fantastic.
You're doing fantastic. And you said you had somebody look at this once before, right?
Yes, a dermatologist.
A dermatologist, and what did they say?
They told me to leave it alone. It wasn't hurting me.
Okay. But it has started bothering you now,
Yeah.
right? Okay, so no problem there. Okay, so you're allergic to iodine, so we're not going to put any betadine on this.
Okay.
Gonzo's going to give me a little cold spray right there. We're going to give you a little injection.
Okay.
There we go, good. A little shot. Stick, sting, and a burn. Are you ready?
Okay.
Stick, sting, and a burn. Hopefully the cold spray helped a little bit.
She's a strong woman.
Well, of course she is. How'd that go? How was that injection?
I didn't feel it.
Good. And hopefully you won't feel any pain. And you might feel a little pressure, but you shouldn't feel pain, okay?
Okay.
You okay?
Yeah, I'm good.
Okay, good. And so we use some lidocaine with epinephrine for this injection to help prevent a lot of bleeding. Okay, good. So now I've made my incision, and so I'm starting to do a little dissection with some scissors. And you might feel me pulling and pushing, those kinds of things. Are you with me?
Yeah.
So if you start to feel some pain, you're going to say, I think I'm feeling pain. And it'll be a sharp kind of pain, not a dull kind of pain. So you've had some work done, I see.
Just a little bit.
Just a little bit.
Mm-hmm.
You just like to decorate?
Yeah. It's my thing. And then I'm OCD, so I don't like it to not be even.
I see, yeah. So then you have to go get another one if they're not evened out, right?
Right.
And I'm going to tell you what, I hope you're wrong, but I'm afraid that you might be right. Because, you know, if you got lots of, you can't overcome those injuries.
See, in college, he was bigger than everybody.
Right.
And faster. Because
Right.
we had already beat him earlier in the season in Seattle.
Yeah.
Well, hell, we let Aaron Rodgers beat us on a bum foot.
If you look down in there, you can start to see the sac right in there. That the cyst is right down in there. See that? So we're just beginning to dissect around it. And hopefully our incision is wide enough so that we'll be able to move this out without extending the incision.
I know he can't run that football.
Oh, did you feel some pain?
Absolutely.
Was it sharp?
Yeah, I just know that it hurt like hell.
Okay, we're going to give you a little more anesthesia here. You ready?
Sure.
Okay, maybe a stick, sting, and a burn. Here you go. There you go. That's where we want to be, right there. You feeling it? Hey, what's for lunch today?
That is so terrible.
The lunch, I think? Well, it's chicken. Sometimes I think these epidermoid cysts, they kind of taste like chicken from what I understand.
Oh, I'll take your word on it. It's okay, don't worry about him. Just finish on me and we'll get to him later.
Oh, trust me, don't worry. If he passes out, we're not going to worry about him.
You are a patient, I think.
Yeah.
Thank you.
We're gonna. You have a lot of scar tissue. I'm really feeling.
Why is there scar tissue? Is it...
Well, sometimes when you have one of these that's been squeezed over and over again, you'll just have a lot of inflammation around it, and you may have had like minor infections that your body has cleared out. But there is a ton of scar tissue around this. It's really challenging to dissect this out.
I told you.
Jillian, yeah. I was trying to think of her fake name. I was about to call her by her name.
Well, you did say what it was.
Actually, I diagnosed her.
Did you really?
Yeah. She showed me before you came in.
I'm gonna tell you what, no wonder your dermatologist didn't want to mess with that. That is all scarred in there.
Well, screw her.
Okay. I was gonna ask you what you thought about that, but now I guess we don't need to.
Are you sure you can put this video on YouTube?
I like that.
You like that one?
I like that.
That was a good one.
That's okay. I'm counting points here, and I'm gonna get them whenever I'm up, and I'm
can.
okay.
You can, and this cyst is coming out.
Is that it?
No, it's part of it.
Part of it.
Okay, look at that right there. See that? That's the old rotten cottage cheesy stuff right there.
True.
There's the bottom of the sac right there. Come on, coconut.
Sorry.
That's terrible.
She's gonna. I'm not
Where do you
gonna
see
send
this?
you.
Where do you see it on YouTube?
Don't, I want to see it before y'all get rid of it.
Okay, we'll save you all the pieces.
But it should
Kingdom
not come
of-
back, right?
No, this won't come back because we're getting the whole thing out inside out. I mean, we are.
So if you didn't get that out, what would have happened?
In time, it would come back if we don't get the sac out. So we're underneath the sac right now, dissecting it out. So being real careful. We're snipping away and we're spreading with the scissors, but there's a lot of scar tissue around this, and as a result, it's making it very challenging to remove this.
Right.
But we're getting it. Look at that. Now this is all sac material that's come out right here. We're going to put it down right here so everybody can see that. See, that's actually sac material, and on the flip side you can see it's got the mucinous type material that we see in these quote-unquote sebaceous cysts / epidermoid cysts. Just a little more to go, Jillian, and you are going to be done.
You're a trooper, Jillian. I give you that.
Oh,
Are.
thanks.
Really are.
Are you kidding me?
Yeah, I know his dad, his sister, and everybody.
It's okay. I'll take the tickets. I can flip them and make a profit.
Oh, that is so wrong. I look forward to that. They're not playing the Cowboys this year. I did not know that. The Texans have really blown it on some draft picks.
Right, right.
And there's just no question. I mean, for as good as they did with J.J. Watt, they've done just the opposite with almost everybody else.
Mario.
That's it.
They still should have got Vince Young.
Congratulations, Jillian. You are now cyst-free. Why don't you get a picture right here? Why don't you get in there and look? See, we've got nice, clean, pink, healthy. There's no more cyst in there. So, can we get a little bit of hydrogen peroxide? We're going to do a little rinse. Make sure we don't have any debris in there. That's all. Perfect. See, we just got a little bit out of there. Excellent. This is going to heal up very nicely.
Thank you.
Yeah.
That's like the one she
Using wash, trust me. Yep.
Really?
Oh, yeah. You're too new. You haven't seen many of the exciting things we've done. Remember that time we took out that appendix right here on this table, Gonzo?
Yep.
Oh my God, really?
No, we
No.
made that up completely. Just to show how gullible you really are.
Uh-huh.
Yeah, she
Yeah?
knows. She knows the routine. That's okay if it does. Now, if it oozes and it starts to, look like it's infected when it oozes, well, then you need to let me know.
Oh, you already know. I'll pick up the phone in a heartbeat and
All
call
right.
here.
Because as it is right now, there's no infection, and we got a nice clean closure here, so there's no reason for you to be on an antibiotic, okay?
Okay, no.
You're going to come back and, yes, just a dressing, just a bandage. You can actually put a little ointment on that today. We don't.
Stay tuned and watch the Meta 7 videos.
Okay, in your own words, tell us about Meta 7. No rehearsing allowed. Go.
Meta 7 is great. I get a lot of energy without the jitteriness. A lot of